Bismillahirrahmanirrahim. And this is the ninth lecture of the general toxicology. And in this lecture, I'll be discussing removal of unabsorbed poison. That how we can get rid of the unabsorbed poisons. This is by the gastric lavage, emetics, activated charcoal, catharsis. Now, what is gastric lavage? This is a process basically of washing out the stomach with different solutions, and also it is called as stomach pumping, stomach washing, or stomach irrigation. That when we receive the patient in emergency and the time elapsed between the ingestion is such that we expect the poison has not yet been absorbed, and we induce the stomach wash. And this is, in that way, it is a life saving if it is performed within 4 to 6 hours after the ingestion of the poison. And in certain cases, it can be done even after 24 hours. For example, in aspirin poisoning, the clumps of the poison aspirin can be attached to the stomach wall, and it should be washed in the later hours. Similarly, opioids. When there is opioid poisoning, there is enterohepatic circulation, and the poison keep on coming to the stomach, and continuous washing will help to remove them. And this is how we do the stomach wash. This is a dummy showing the position and the procedure. So the principle of stomach wash is it is the siphon action. That is the negative pressure which sucks out the fluid from the higher level, because we keep the patient in such a position that the cardiac end is higher and the mouth is at the lower portion, and we can suck out the contents of the stomach. So it is the principle under which the gastric lavage is performed. According to this principle, the fluid flows from the higher level to the lower level having the negative pressure, which sucks the fluid from the stomach. And the fluid used in the gastric lavage, they are normally warm water, sometimes the saline, and sometimes the KMNO4 or the tannic acid or iodinated water. Then the calcium gluconate for oxalic acid. And why the gastric lavage is performed in left lateral position? Because this is the position in which the patient should be maintained, that is left lateral position. Because the right main bronchus, which is about 2.5 centimeter in length, is shorter, wider, and nearly vertical than the left main bronchus. So the possibility of contents going into the left main bronchus are more. So the position that the left lateral should be so that we cannot induce the contents in the right main bronchus, because it is almost a direct line with the trachea. The foreign object traversing the trachea are most likely to enter the right main bronchus. So as compared to the left bronchus, which is 5 centimeter in length, longer, narrower than the right. Now the types of tubes which are used in adults, it is the Jacques tube, which is normally called a stomach wash tube, which is a thick rubber tube, about 12.5 millimeter external diameter, and in children we use the Rice tube. And the length of tube in adults, it is 50 centimeter, and in children it is 25 centimeter. The procedure is that the patient is kept in left lateral position with the level of head below than that of the body, and it prevents regurgitation into the respiratory tract. and it causes pooling of the contents in the cardiac end of the stomach, which will assist drainage. That will be higher, and from the higher level, the contents will flow down. The airway is cleared, the mouth gag is applied, and the lower end of the tube is lubricated with glycerine or liquid paraffin, and it is passed through the mouth gag hole over the tongue down to the esophagus and stomach. Then confirm the position of the tube in stomach by auscultating over the stomach area and uh, by pushing some air. That with the syringe we push some air, and with the stethoscope we hear the stomach area, and a bubbling sound will come there. That means the tube is in the stomach. Then 300 milliliters of warm water or saline is poured. First washing is preserved and should be sent for chemical analysis. The washing is kept on with warm water or any other antidote till the color of the fluid which is coming back is that of the lavage fluid. If it is plain water, when it becomes plain and colorless, that means the wash has been completed. When the poison has been removed by the lavage after that, some fluid must be left in the stomach to deal with the small quantities of the poison left in the stomach which may have escaped lavage. For example, magnesium sulfate, sodium sulfate, and soda bicarb or activated charcoal to adsorb alkali. These are the things which should be kept there. And the tube should be pinched to prevent the aspiration into the lungs when you are going to remove the tube. First, you should pinch it and then you should remove it. Now, about the contraindications of stomach wash: corrosives, convulsions, unconsciousness, or if you suspect some foreign body, petroleum distillates, esophageal varices, and severe electrolyte imbalances. So these are the conditions in which you should not try to attempt the stomach wash, but the absolute contraindication is corrosive poisoning. In corrosive poisoning, you should not attempt it because the corrosive poison they have corroded the ulcerated the uh, canal, the esophagus, the stomach, and the tube may perforate the canal. With other conditions, you can perform with safety measures, but this corrosive poison, it is the absolute contraindication in which you should not even attempt it. Now, regarding the complications of gastric lavage, it can cause aspiration pneumonia, laryngeal spasm, mechanical injury to the throat, or sometimes rupture of the esophagus and stomach. Electrolyte and acid base balance, because you are irrigating the stomach again and again with the fluid and aspirating out, and it can lose the electrolytes. Now, the activated charcoal is given. What is activated charcoal? It is a fine black, odorless, tasteless type of amorphous carbon. And the source is basically it's being formed by the steam distillation of wood, coconut shells, or coal. And it decreases the absorption of various drugs and poisons by absorbing them on its surface. And each gram of activated charcoal works out a surface area of 1000 meter square. And it is not effective in acid and alkalis and water-soluble poisons. So this is the charcoal. The indication of charcoal is it is given in salicylates, paracetamol poisoning, and barbiturate poisoning, and antidepressants. The procedure, how we make the, how we induce it, we use a water slurry, that 4 parts of water added to desirable quantity of activated charcoal after the emesis or the gastric lavage. First, you do the gastric lavage or you induce the vomiting, and then you put on the activated charcoal. The dose is 1 gram per kg body weight. It can cause complications: nausea, vomiting, diarrhea, constipation, pulmonary aspiration, intestinal obstruction can be with this product. And it can cause corrosives also. And it is contraindicated in corrosives, heavy metals, and alcohols. So, in corrosives, heavy metal, and alcohol, it should not be given. So, the method for preparation of activated charcoal, this is physical activation, that uh, they heat up the carbon source to extremely high temperature, between 600 and 900 degrees Celsius, and they use the hot gases in an inert atmosphere first, either the nitrogen or argon. Then this carbonized material is reintroduced into an oxidized atmosphere, again in an extremely high temperature. Then they can do the chemical activation. That was the physical activation with the uh, heat stream, but the chemical activation can be with an acid or a strong base or a salt to the carbon source before it is heating. So this method decreases the temperature at which the carbonization and activation occurs. So either way, that you do the physical or the chemical activation, the process results in extremely fine black powder. And this powder has millions of tiny pores and massive surface area. So one group of researchers, they developed the activated charcoal with a surface area of 3000 meter per single gram. The normal activated charcoal offers per gram 1000 meter square, but sometimes the researchers, they have developed in such a way, such a fine particle, that each particle is offering a surface area. So 1 gram will be offering 3000 meters. Therefore, the activated charcoal is ideal for tapping certain toxins. Now, the cathartics. These are the substances which increase the motility of the gastrointestinal tract and helps to expel the poison from the body. They induce diarrhea, and the product is washed away in the stools. Mechanism of action is that it works by increasing the gastrointestinal motility. The contact time between the poison and gastrointestinal mucosa is decreased because it is hurriedly passing through the alimentary canal, and later on the poison is propelled out with the passage of the stool. So the commonly used cathartics: magnesium citrate 4 milliliters per kg, magnesium sulfate 5 to 10 grams in adults, sorbitol 50 milliliter 1 to 2 grams per kg. Now regarding the contraindications, it is contraindicated in corrosive, with severe diarrhea, abdominal trauma, renal failure, and acid-base balance disturbances. It is contraindicated. So thank you very much. This is all about the today's lecture. Take care. Allah Hafiz.